Do you suffer endometriosis and inflammatory conditions in your pelvic region? Do you suffer from chronic pelvic pain? I'm Dr. Lonnie Herman, and in this video I want to share with you a report on an examination that I just stepped out of in the exam room here in my clinic. And a woman with chronic endometriosis problems, chronic pelvic pain. She already had a dilation and curettage. She's already had hormonal therapies, does not want a hysterectomy. The doctor recommended to her that the D&C was going to help remove scarring in her uterine lining, or the endometrial lining, excuse me. And it turns out that the pain came right back within a month. She also was told by this gynecologist who did the procedure that after she had the scraping done and the pain came back, the doctor looked at her and said, well, I guess you'll just have to live with your pain. And she wasn't satisfied with that. So here is a second exam in my clinic with this patient. She's 38 years old, and in the last round, which I'll make a video about, she had serious endometrial infections that we went after in the first round of her care. And in this round today, and she still is suffering with the same amount of pain. Let me just be clear. She went through one protocol to clean up some infections in certain tissue in her body, yet she still has the same pain. Let me explain before I even get into this protocol. What you've got to understand is that you can have, not only do you have an endometrium, you have, or endometrial tissue, you also have fallopian tubes on the right and left side. You also have ovaries on the right and left side. You also have a cervix. You have a vagina. You have a uterus. You have these different tissues that can, you have what's also probably you've never heard of before in your body because they can't test it in the gynecologist's office, the pudendal muscle and the pudendal nerve. These are areas that I get to check. The corpus luteum. These are areas that I get to check when I'm doing an examination on a female patient. So after she went through the first endometrium procedure with me, the first protocol, which lasted for about 5 days, she still comes in with the same pain. And I had to help her understand, out of her frustration, I had to help her understand that there's more than one tissue in her female reproductive system tissues that can be and are infected. Okay? So is the chronic pelvic pain caused by only one tissue being infected or toxic? Or is it caused by multiple tissues being infected and toxic? And that's what we're seeing here. A very, very interesting examination took place this morning, and I want to share this with you. I have samples, by the way, to let you know as we get into her report of her exam findings in just a moment. I have samples of various human tissues of the body that I can study, and like a sniper, I can pinpoint right on the target which tissue is weak or stressed in the body, which tissue is infected and or toxic in the body, so that we know exactly what we're doing. There is no guesswork. There is no guesswork in this clinic. In her fallopian tube, she has a very high level of Lyme infection called Borrelia burgdorferi. That Lyme infection can be in 20 or 50 or 100 different tissues at the same time in your body, and one pill, one shot, one series of whatever kind of therapy a so-called Lyme literate medical or natural doctor is providing for you cannot possibly take care of every single one of these critters that's in every single tissue. You can have 50 Borrelia burgdorferi bacteria in the cervix, and you could have 500,000 of them in the endometrial tissue, and you could have 600,000 in the uterus, and you could have 20,000 in the fallopian tube, and another 50 of them in the ovary. You can't use the same exact remedy or therapy or herbal or whatever you're trying to use. You can't use the same thing for each amount of infection. It's the same bug, but in different amounts. One bullet might kill one human being, excuse me for using that example, but one bullet's not going to kill 200 million or 200,000 humans. One bullet can handle one. It's not going to handle 200,000 of them. That should make sense to you. So we found a very high level of the Borrelia burgdorferi bacteria in her fallopian tube. We found residues of tobacco smoke She is not a smoker currently. She did go through a short period of time in her life where she would smoke when she was out with friends drinking. Tobacco smoke residues in there. Multiple bacteria, intracellular bacteria in her fallopian tube. The Bartonella infection inside the fallopian tube. She has mold and fungus inside her fallopian tube. She also has the parasite called Babesia microti inside her fallopian tube. Specific remedies are made for each one of these infections at specific potencies to take care of each individual level of infection in her fallopian tube. Nowhere else in her body where these infections may be existing, nowhere else, most quite possibly nowhere else is going to be affected. So if the Borrelia is in her, let's say her mitral valve of her heart, it's probably not going to be, unless it's the same exact level of infection, the same exact number of critters in the mitral valve of the heart, it won't be affected in another tissue. So as we go on down this system of examination that I use so elegantly in my practice, the uterine ovary tissue, the ovarian tissue with the uterine tissue is also infected with the Borrelia burgdorferi bacteria, the Lyme infection at a much lower level, seemingly so far at a much lower level than what the fallopian tube is. And we'll find out on the next exam, is the fallopian tube clear after she follows this protocol, and is the ovary clear after she does this protocol. She also has roundworm in the ovary, and she also has multiple parasites in the ovary tissue. This woman is coming in here not only because she's got chronic pelvic pain, but she has, and she feels inflammation, and she feels swelling down there in her lower abdomen, but she also has a chronic mid-back and lower back pain that just does not let up. She's had multiple massage therapy visits with a great massage therapist, so she tells me. She never gets relief of the pain. She's had, in my clinic, some chiropractic adjustments, which give her no relief from her pain. She's had some different kind of numbing creams that she's had applied to her back muscles, no relief of the pain. Infrared therapy, no relief of the pain. Laser therapy, no relief of the mid-back and low back muscle pain. So my proposal to her is that when these tissues in her reproductive system are infected, or inflamed, or swollen, the nerves that are connected to these tissues are sending stressed signals to the brain, and the brain is causing all the muscle spasm in the spine. When we relieve the problem to the organ, and the organ stops screaming, the symptom of the muscle spasm may just disappear on its own, or the massage therapy visits that she does like to go for would actually provide her some relief. Again, when the organ is screaming to the brain and the brain makes the spasm develop, you can't get relief of the spasm until the brain stops sending out these extra spasmodic signals to the muscles, until the brain stops getting signals from the organ that's screaming, help, I'm in pain, I'm suffering because I'm infected. Does that make sense? Fix the organ, relax the brain, muscle spasms can then be relieved in the back. So in addition to the fallopian tube and the ovary, I found in her cervix, and this is very unique today because rarely can I get to all three tissues in the body of a female system. Usually there's some other tissues that need help, but it was very interesting for her. The cervix was also a weak tissue. The cervix had mold and fungus. It also had roundworm, just like the ovary. It also had the Bartonella henselae infection, just like her fallopian tube. And it also had a very high level, much higher than the fallopian tube, a very high level of the Babesia microti parasite. This patient, until these infections are completely eliminated from her reproductive tissue, there is no way that she's going to have pain relief from her chronic pelvic pain. There is no way that she's going to have pain relief because she already tried hormone therapies, she's already tried a DNC, she's already tried various different anti-inflammatory medicines and over-the-counter medicines, none of her giving her any relief. When she gets rid of these infections with my kind of work without using an antibiotic, without using a drug of any kind, with using specific targeted remedies that will help her body, help her immune system eliminate these infections and toxins from her tissues, that is the time that she will witness, first time that she will witness complete pelvic pain relief. She will have alleviation of her chronic pelvic pain, and I propose that she will have the mid-back pain relief, or at least the massage therapy will work to give her relief. Please share this information with just one person. Just one person deserves to hear this information. If you could just share that with one person. Like me on my Facebook page. I share information there all the time. I try to do it every day, but usually every other day or a few times a day I'm getting information up there, as well as subscribe on this YouTube channel because I'm putting information up all the time, and you will be one of the first to see and hear these videos of these amazing exam findings and even patient testimonials that I put up on a regular basis on my YouTube channel. We'll put that address on the screen here. Thank you very much, and I look forward to sharing more information with you. You can call my clinic, by the way, 954-370-3100, and I look forward to helping you.